Hello everyone. Today we are going to talk about the menopause. So menopause you might have heard. So what actually happens in the menopause? So before saying that, I will say about the menstrual. So what do you mean by the menstrual cycle? So we can say when the woman is having the every month the bleeding is coming from her vagina. So that is known as a menstrual flow. Otherwise you can say the menstrual cycle. Otherwise you can say the bleeding which comes from the vagina, right? So this is when she attend to the puberty age. Okay, so puberty age most probably it ranges from the 11 to 12 or 13 or 14, anything. So that is depend on the girl's physiology also, right? So here what it means, the initiation of the menstrual period, that is known as a menstrual, okay, or you can say the puberty also. But here the menopause, it means it is the opposite of this, okay. So here in this what happens when the woman is about to stop her we can say the bleeding, okay. So we can say the physiologically this the bleeding is there, that will be stoppage will be there. So we will see in detail. So first of all we'll be talking about the definition. So menopause is defined as a permanent physiological cessation of the menstruation at the end of the reproductive life. So here what happens physiologically, so we can say the physiology of every organ will be there, right? So ovary is there, so ovary also have the some amount of the primary oocyte. So primary oocyte is known as the ovum, right? So every month what happens, from there will be the two ovaries will be there, right? Left and the right. So if the one ovum has released from the left, so next month what happens, from the right one it will come the next ovum, right? So we can say that is the what is the main function of the ovaries, to release the ovum from the ovaries. So when the that phase is known as a ovulation. So when the ovulation is there, so after that only two things will be there. If the fertilization happens, so the pregnancy will be there. If the fertilization has not occurred, so that everything, whatever the change, like the ovum is there, then the changes will come inside the uterine cavity and everything, their wall and everything, the layers of the uterus, everything will be have the changes. That everything will come out of the vagina in the we can say the through the blood, and we can say the cell of the this uterine wall, the shading of the cells and tissue, that will be there, and even though the ovum also will be there, right? So that every flow will be coming at the end of the month, okay. So that is depend on the woman's physiology also. So here what happens physiologically, this every month whatever the mother is getting bleeding, that will get by stop, okay. So here what do you mean by the another word is the reproductive life. So what it is, so reproductive life, it means that we can say another name, that is the childbearing age. So there is a when the puberty is about to start, or we can say when the mother has attained to this menstrual flow. So from that point of time she can have a pregnancy, okay, until the when she attend to or when she have the menopause, till that time or between this period she can have the pregnancy, okay. So here what happens, at the end of the reproductive life the menopause will be there, physiologically cessation it means stoppage, okay. There will be the no more any bleeding will be there. So due to the loss of ovarian follicular activity, so that is what I said earlier also, this ovaries are there, in that the primary oocyte will be there, right? So primary oocyte also known as a ovum, right? So that will be releasing from the ovary. If the primary oocyte are not there inside the ovary, how the ovulation will be there? So that's why when the number of the ovum are there, that are reduced in the number, so what happens, there won't be the bleeding, or there won't be the menstrual. So here what happens, physiologically cessation will be there of the menstruation. So it is the point of time when the last and the final menstrual comes. So here what happens, this is the phase, or this is the time when the woman will have her last menstrual period, okay. After that she will not have any kind of bleeding from the vagina. So we can say every month she won't have any kind of menstrual flow also. So this is the definition. Now we'll be talking about the climacteric. So what do you mean by the climacteric? So it refers to the entire transitional phase between the sexual maturity and the menopause. So what it means, when the woman is entering to the childbearing age, at that time the changes between, or we can say the changes inside her body, that will be different. But when she is entering to the non-reproductive age, okay, or we can say in the menopause phase, that time what happens, her body, whatever the organs are there, the changes also will be there that time. So this is the both the phase of the life when she will have a different feelings also, and different changes also will be there, physiological changes also will be there. So here what happens, the entire transition will be there. So here she will be converting from the one life to the another life. Okay, so we can say the childbearing age, that is also one another life experience for the mother, and we can say the menopause is a period, so that time also she will have another kind of experience. So it is a phase of aging during which the woman passes from the reproductive to the non-reproductive stage. So that is what, when the woman is having the reproductive age, from that she will be passing through and she will be coming into the non-reproductive age. So we can say when the woman is she is in reproductive age, that time she can have a pregnancy. But when once the non-reproductive stage comes, after that she won't be able to get the pregnancy. So this is so what is the meaning of climacteric? The transition from the reproductive to the non-reproductive. So that between phase, that is known as a climacteric. Then after pre-menopause. So what is that? So it is a part of the climacteric before the menopause. So before the actual menopause comes, so before that period is known as a pre-menopause. So here what happens, when the menstrual cycle is likely to be irregular. So what happens when she is in a reproductive age, or we can say the childbearing age, that time every month she will be having the periods, or we can say the menstrual cycle. But in this what happens, whenever she is about to reach to the menopause time, that time her menstrual flow and menstrual cycle will be irregular. Okay, so we can say sometimes she will be getting 2 months has passed, but till now she has not get the menstrual flow. Okay, so maybe some gap will be there. Okay, so that is known as a pre-menopause. Now we'll be talking about the post-menopause. So what it is a phase that comes after the menopause. So when the actual menopause has started, after that phase is known as a post-menopause. So here we have seen the three things, that is a climacteric. So climacteric we say the complete transition when the mothers come from the reproductive to the non-reproductive phase, right? And the pre-menopause, so when the actual menopause starts, before that period is known as a pre-menopause. And in that what happens, the menstrual flow is there or menstrual cycle is there, that are likely to be happen like the irregular one. And the post-menopause, when the menopause has already started, and after that phase is known as a post one. Okay, now we'll be talking about the age of menopause. So what kind of age we can consider as a menopause? How we can say that this mother is having the menopause? So there are the certain age are there. According to that we can say this woman can have the menopause. So age of the menopause is genetically predetermined. So already before itself they have said that this age can be considered as a menopause. So age of the menopause ranges between the 45 to the 55 year of age. So we can say when the woman comes to the 45 or when she comes to the 50 year of age or something, that time she can have the menopause. So average being the 50 years. So we can say here they have given the average age of the menopause, that is the 50 year of the age. Then after cigarette smoking and the severe malnutrition may cause the early menopause also. So when the woman is consuming the alcohol, otherwise we can say the smoking cigarette is there. So if she is addicted to that, so that is of course we know that this all the substance are there, that is going to affect the body of the any human being, right? So when the woman is consuming this kind of substance, so what happens? Oxygen carrying capacities are there, that is going to be reduced. So we can say when the oxygen has reduced inside the body, of course all the organ is going to get affected also, right? So in the case of the smoking and alcohol or severe malnutrition, if she is not eating enough amount of the nutrition, so that time also this can happen. So for this kind of woman, maybe the early menopause can be there. So this is the age of the menopause. Now we'll be talking about the organ changes, because as I have said earlier also, when the woman is having the reproductive age, that time also so many changes will be coming inside her body. But when she comes under the menopause, that time also she will have the many changes also. So we will see one by one about the each system. So first of all, we'll be talking about the genitourinary system. So what happens in this? So ovaries shrink in the size. So what happens? The ovaries are there, that will shrink in size. So what happens? The size of the ovaries will be that will be decreased. Okay. Why? Because all the muscles and everything are there, that won't be we can say after a few years the aging process will be there, because every organ and everything will have the aging factor also, right? So that's why their function and everything will be altered after some age. Okay. So here what happens? The ovaries are that will be shrink in size. Then after become the wrinkled and the white. So what happens? The ovaries will have the small wrinkles over it, and it will become a white in color. Then after, fallopian tube shows the features of atrophy, muscle coat becomes a thinner. So here the atrophy also will be there of the fallopian tube, okay, and the muscle coat are there which will become the thinner. But when she was in a reproductive age, that time this muscle coat was there, it was a thicker. But what happens after some age, the degeneration process will be there, okay, due to the aging process. Then after, uterus becomes smaller and the endometrium becomes thin and the atrophic. So here what happens? Even though the uterus size is there, that is also going to be shrink. Okay, so that capacity and everything is going to be reduced in the size. Then after, even though the endometrium cavity is there, because endometrium cavity is really important for the pregnancy. So this also is going to be become very thin and the atrophic. Then after, vaginal pH, vagina becomes narrow due to the gradual changes, or we can say the loss of elasticity, and the vaginal pH become the alkaline. So here what happens? Even though the vaginal part is there, or the vaginal canal is there, that is also going to be very narrow, because all the muscles and everything will have the atrophy. Then after, what happens? Why this happens? Because the muscles and everything has lost their elasticity. So that's why what happens? The canal will be a little narrow. Then after, vaginal pH is there, that is also going to be alkaline. So before it was acidic. Okay, when the woman have the reproductive age, that time what happened? The pH will be acidic. Why the pH will be acidic? Because it helps to kill the microorganism from the outside. Because we can say the woman mostly prone to get the UTI. Why? Because if the pH is not good, so sometimes the microorganism are that can enter into the vaginal canal. So at this time, the pH is that will become the alkaline. So we can say the woman, when she have the menopause, that time there is a most chances to get the UTI, that is a urinary tract infection. Then after, vulva shows the features of the atrophy. Even though the vulva are there, that also become the atrophic. Then after, labia majorum are flattened and pubic hair are scantier, resulting in the narrow introitus. So here what happens? Labia majora and the minora are there, they also would get affected. So here all the cell and everything will be decrease in the size due to the aging factor, right? And due to the hormonal changes also, because when the mother have the menopause, that time also so many hormonal changes also will be there. So due to that also the changes will be there. So here what happens? The labia major and minora are there, that will become a little flatter. So flatten will be there. Then after, the pubic hair. So at the pubic part there will be the hair. So that also will be reduced in the amount. And because of all these all changes, the introitus are there, that is also becoming narrow. Then after, breast fat get reabsorbed and gland atrophy will be there. So as you can see in this picture also, at the 20 year of age, how the breast can look like. Okay, when the 30 year of age are there, that time a little sagginess will be there. But when she receive the 40 years, that time this breast will be completely saggy will be there. So we can say this is all because of the hormonal changes and the physiological changes also, because here all the cells and muscles and everything are there, that is also going to be decreased in the size. So here what happens, whatever the breast fat are there, that is also going to have a reabsorption process, and after that what happens, the glands are there. The glands, why it is what it helps, it is going to help for the milk production also, right? So that glands and everything are there, that is also going to be atrophy, mammary gland, right? Then after, nipple decrease in the size and breast become flat and the pendulous. So that is what pendulous and the saggy both have the same meaning. So here the nipples are there, that is also going to be reduced in the size, smaller size will be there, and the breast will become a little we can say the flat. Why? Because here the, as we have seen, the fat, it is going to be reabsorbed. Okay, that's why the fats are there, that also will be reduced. So that's why the breast will be a little flat. Then after, bladder and the urethra become the thin and is more prone to damage and the infection. So here what happens, when the any organ loses their elasticity or any due to this aging factor, if they decrease in the size and everything, so that time they are more prone to get the infection also and damage also. Very easily that can break also. Okay, so this when the mother is in a menopause, that time every organs become more fragile, you can say. So here what is going to happen, bladder and the urethra, that is also going to be very thin. Okay, and it is more prone to get the damage also and the infection, like the UTI, that is a urinary tract infection. Then after, loss of muscle tone leads to the pelvic relaxation. So here what happens, all the muscles are there, that also will be loose, that tone also will be a little lost. So what happens, the pelvic relaxation will be there, and the pelvic floor and everything, that is going to help to support the uterus also. But what happens, due to this aging factor, the hormonal changes, everything is going to have an effect, and because of that the pelvic also will become a very relaxed one. Then after, uterine descent and the anatomical changes in the urethra and the neck of the bladder. So here what happens, if you know the anatomy of the uterus, okay, or anatomy of the internal reproductive organ, so the uterus will be at the center point, front part is the bladder, behind part of the uterus, it is the rectum, right? So the uterus have the anti-flexion and the anti-version position. So what happens, if the pelvic floor, already we have seen earlier that the pelvic relaxation will be there. So once it has happened, so what happens, the uterus size is there, because pelvic floor and the ligaments are there surrounded, so that also will be loose enough. So what happens, the position of the uterus is there, it is also going to change it. Okay, that's why what happens, uterine will descend. So the uterine is there, that will come a little downside. And what happens, the anatomical changes will be there in urethra also and the neck of the bladder also. So till now we have talked about, that is the urinary, what was there, that was a genitourinary system. Now we'll be talking about the skeletal system. So how the skeletal system is going to get affected. So following the menopause, there is a loss of the bone mass by the 3 to 5% per year due to the deficiency of estrogen, leading to the osteoporosis. So as you might have heard also, the aged women are there or aged people are there, if they fall down, there is a most chances to get the fracture. Why? Because their bones are there that are weak. Okay, why? Because at the age of the we can say the aging factors are going to affect, because the deficiency of estrogen is going to reduce the mass bone. Okay, that's why. So here they have said, the following menopause, there is a loss of the bone mass by the 3 to 5% per year. So you just think that at the year of the 50 year of age, the mother, any woman has got the menopause. So we can say every year the 3 to 5% the bone mass loss will be there. So you can say the bones of the woman, they will be a very fragile one. So why this happens? Because the deficiency of estrogen, and if it happens for a prolonged time, so that is going to cause the osteoporosis. So that is also one bone disorder you can consider. Then after the CVS, how the CVS system is going to get affected. So that deficiency of the estrogen increases the risk of the cardiovascular diseases because of its function decreasing the HDL, cholesterol and antioxidant properties. So what happens here? Here the deficiency of estrogen that is going to be increased. So when the estrogen hormone, as I said earlier also, this all the changes will be coming. Why? Because of the hormonal imbalance, or we can say the hormonal changes. So because of that, what happens, if the estrogen is going to decrease, that is going to increase the we can say the cardiovascular disease, okay, like the heart attack or something. The cholesterol level and everything will be increasing for this all the woman. So here what happens, because if the we can say the cardiovascular disease is going to increase, so that is going to decrease the HDL. So you can say the high density that fat is there, that is going to be there. Okay, if is there, so what happens, there is a most chances to get the heart attack and the some disorder like the for this cardiovascular disorder will be there, or even though the antioxidant property also will be there. So that also will be reducing. Okay, now we'll be talking about menstruation pattern prior to the menopause. What kind of pattern you will see before the actual menopause happens. So we can say we are going to talk about the premenopausal phase. So here, abrupt cessation of the menstruation. So here you can say whatever the menstrual flow is there or menstrual cycle is there, the pattern is going to be changed. Okay, so I said earlier also, sometime it can come for the 1 month and again 2 months won't be coming, then after next month will be there, then suddenly what happens, every month she will be getting, then again the 2 month or 3 months she won't be getting. So this way irregularity will be coming. Then after a gradual decrease in the both amount and the duration, it means that we can say normally when the woman is having the menstrual, about the 30 to 40 ml of blood she will be losing. Okay, so during the menstrual cycle. Okay, so here what happens, that duration, so we can say to sometime if the mother was reproductive age, that time her duration was about the 5 days, but when she came into the menopause, what happens, it will come to the 3 days, 2 days, like that. So we can say the duration is also going to be reduced, and the amount, so when she's have the menopause, that time she might be losing like the 20 ml or 10 ml of the blood loss will be there. So this is how amount and duration both is going to have the effect. Then after irregular with or without excessive bleeding, sometime only it will have the excessive bleeding, or sometime it won't have the excessive bleeding. Okay, so this kind of pattern you will see in the premenopausal phase. Okay, as you can see here, the menopausal symptoms, as you can see, headache and the hot flushes will be there. So headache and what is the hot flushes, we will see in the next slide. Then after the teeth will be loosened, then the gums also will be reduced. Then after hair also become the thinner, and the loss, we can say the loss of hair also sometime will be there, and the hair, the quality of the hair is there, that also will become very thin. Then there is a chance to get the cardiovascular disease. Why? Because there is a we can say due to the deficiency of the estrogen hormone, and that is going to increase the HDL, okay, and the antioxidant properties. Then after breast drop and the flatten. So what happens, the pendulous this breast will be there, or the sagginess will be there. Okay, or even though the fat of the breast are there, that also will be reduced. Then after nipple becomes, what happens, the smaller in the size, and that also will be a flatten. Then after she might have the backache. Why? Because here the skeletal system is also going to get affected. Then after skin and the mucus becomes drier, and skin develop a rougher texture. So what happens here, due to this all the changes, the skin also will have the more wrinkles. Then after body and the pubic hair become thicker and the darker. Here what happens, the hairs are there, that will be a scantier. So the whatever the growth of the hair was, or pubic hair, that will be reduced. Then after abdomen loses some of the muscle tone. Even though the abdominal muscles are there, also that will lose their tone. Then after stress or the urge of the incontinence. Here what happens, the bladder will be becoming a little weak. So when the woman is about to work, that time she won't be able to hold it. Okay, so that's why we used to say that whenever the people have the aging factor, that time they will have a more problem for the urination. Okay, because sometimes they are not able to hold it for a long time. Then after bone loses the mass and they become more fragile. So we can say, already I said earlier also, due to this estrogen hormone deficiency, osteoporosis also will be there. So even if they have any accident or any fall is there, so that time what happens, there is the most chances to get the fracture. Then after vaginal dryness will be there, itching will be there, and the shrinking in the size. Even though vagina is there, that is also going to decrease in the size, and the pH that will become the alkaline. Okay, so this kind of symptoms you will see. Okay, so as I said earlier, the hot flush I will say. So let's talk about that. So that is a vasomotor symptom. Okay, so what happens here? The characteristic of the symptoms is the hot flush. It is characterized by the sudden feeling of the heat followed by the profuse sweating with the cutaneous vasodilation. So here what happens, mothers will be feeling like a profound sweating. She will have the severe sweating, or you can say the perspiration also, right? So that will happen suddenly. Okay, maybe this hot flush used to happen at the night time also. So here when she is having this kind of sweating, that time she might have the cutaneous vasodilation also will be there. Okay, so here they have shown some signs and symptoms of the hot flush. So here you can see flushing or the reddening face. What happens when she have the sweating or the hot flush, that time what happens, her face and everything will look like a red in color. So what happens, the neck, the particularly lighter area or lighter skin area, that will become the red in color. Then after sudden and intense feeling of the heat, so that will be where the feeling of the heat will be there. So that will be over the face, neck, arms, torso, and sometime over the whole body. She will be feeling like the perspiration. So these specific things are there, that is known as a hot flush. So rapid and the irregular heartbeat will be there. So why? Because vasodilation is there, that's why. So here what happens, the pulse including the heart, the palpitation also will be there. Then after the perspiration ranging from the mild to profuse. So here what happens, the perspiration is there, or we can say the sweating, that will be ranges differently. Might be sometimes she can have the mild, or sometimes it can be the severe also. Then after the cold chills, sometimes she will have the we can say she will be feeling the hot also, and simultaneously she might have the chills also. So often follow the hot flush, though sometimes women only experience the chill. Sometimes it can have the hot flush also, or sometimes it can have the chills also. Then after the sleep disturbance, so here most probably as you can see, the characteristic of the hot flush that occur at the night, most probably the hot flushes used to happen at the night. So when the sweating is there, of course the mother is not going to have a good sleep. Any woman will disturb her sleep because of the hot flush. Then after the genital symptoms, what kind of changes will be there in the genital? So let's see. So that is a dyspareunia. So what happens in this genital pain during or the after sexual intercourse. So whenever they have any sexual activity, that time they might have the pain. Okay, mother will have the pain. Then after the vaginal infection, why? Because there is a pH value is there, that is going to be alkaline. So that is the most chances to get the infection. Then after the dryness also will be there. Why? Because the pH and all the cells and everything has got the decrease in the size. So eventually the secretion which is going to we can say going to moist the area of the vagina, so that is also going to be less. Okay, so what happens, the dryness also will be there. Then after the pruritus, that is a severe itching will be there. Then leukorrhea also will be there. So what is that? So flow of whitish, yellowish or the greenish discharge from the vagina of the female. So here what happens, there is a chances to get the leukorrhea. So this kind of genital symptoms you will be seeing. Then after the urinary symptoms, what kind of will be there? Urgency. Why? Because here the woman won't be able to hold the urine for a prolonged time. So she will have the urge to void the urine. Then after the dysuria. So what happens whenever she go for the urination also, maybe she is not able to complete her discharge. She won't be able to do from the bladder. Then after the stress incontinence. So here also, if while she there is the urgency to do the voiding process also, but while she go also, that time also she is not able to completely empty the bladder. Then after the frequent UTI, so there is the most chances to get the UTI. Then after the psychological symptoms, so because of course all the physiology is going to affect the mental status of the woman also. So here what kind of changes will be there? So here the increased anxiety, of course she will not because this phase is about hot flushes will be there, all the changes are coming inside her body, so she will be a little anxiety also will be there, she have a little tension about that also. Then after the headache also will be there, insomnia will be there. Why? Because of the hot flush also. Then after the irritability will be there. Then after the dysphoria, then after the depression also will be there, dementia, even though the mood swings and the inability to concentrate also seen. Why? Because this is everything is related to the hormonal changes also, because hormonal changes is going to affect the brain also. Okay, so we can see this kind of symptoms also will be there. Then after the osteoporosis, so it occur due to the estrogen loss, deficiency of the calcium or the vitamin D. So here what happens, why the osteoporosis will be there? So that is due to the estrogen deficiency. That hormone if it is less in amount, so that can happen. Then after the deficiency of the calcium, so that is also going to be there, or vitamin D. So that everything is going to have because of all these factors that can have the osteoporosis. So here they have given the different things. So back pain will be there, kyphosis will be there, then after the fracture of the bones also will be there. So as you can see, this is the normal spine, and this is, as you can see, a curve is been there over the spine. So that is known as a kyphotic spine. So this kind of changes can come during the menopause. Then after the cardiovascular and the cerebrovascular effect, so there is a chances to get the ischemia, stroke also will be there, heart disease will be there, coronary artery disease and the stroke are increased. So as you can see, this kind of changes can be there for the cardiovascular also and cerebrovascular also. Then after the diagnosis of the menopause, how you can diagnose that this mother is having the menopause? So first of all, cessation of the menstruation for the 12 consecutive month. So we can say continuously for the 12 month, if she is not getting the menstrual flow or menstrual cycle, so you can say this mother is in a menopause phase. Then after the occurrence of the hot flush and the night sweat, so if she is having this kind of symptoms as we have seen earlier, okay, so mainly the main symptoms that is known as a hot flush. Then after features of the low estrogen on the vaginal cytology. So if you go for the vaginal cytology, so you can say the examination if you go for, or if you take the swab or something, so from that also you can see there is a low level of the estrogen hormone. Then after the serum estriol, so that if it is a less, okay, so that is also going to suggest that mother is having the this menopause. Then after the serum FSH and the LH, so we can say when the follicle stimulating hormone and luteinizing hormone, this both the hormone are really important for the ovulation and this follicles are there for their maturation. Okay, so if that is going to alter, so we can say that is a sign of the menopause. So at once a week for the 3 times, so we can say this kind of test you have to do once a week for at least 3 times you have to do it. So that was everything that's about the diagnosis. Now we'll be talking about the management, how you can do the management for the menopausal woman. So first of all, the counseling. So here the proper counseling if you give to the woman, so many the psychological symptoms as you have seen that can be reduced. So adequate explanation to every woman with the symptoms may help to understand and accept the changes. if you are explaining the mother about the menopause before itself, okay, the woman who is in a late 30s or we can say late in 30s, so for that kind of woman also you can take it and you can give the education. So you can tell them, okay, this kind of changes if it comes, so don't be panic, don't take tension. So this all are the natural changes will be coming, and you will be having the menopause. So what happens, once you say to them, they will be get ready for the changes also. So they won't be, after your education, they won't be panic also. So that's why, so whatever the changes is coming, she will accept it. Those who have the artificial and the early menopause due to the bilateral oophorectomy or the radiation may require more reassurance. So here for the some kind of woman, they might have the early menopause, okay, like the oophorectomy. If the mother due to any reason, if they have removed the ovaries and the fallopian tube, so what happens for that kind of woman, they we can say the menstrual won't be there. So for them also you have to give health education very nicely. Otherwise, if she has taken any radiation therapy, so due to that also the menopausal, we can say the menopause will be early. Then after the diet, so what kind of diet the mothers should take? So here the nutritious diet, as we have seen earlier also, if the woman is a malnourished, for them what happens, early menopause can be there. So make sure if they are eating the healthy food and the nutritious food, what happens, there is a chances to get the later menopause, or we can say when the menopause has to come, that time she can have it. Then after the supplementary calcium. Why? Because there is a most chances to get the osteoporosis, right? So due to the deficiency of the calcium. So that's why we have to give the supplementary therapy of the calcium. So total daily requirement is a 1.5 gram. So you make sure that you are meeting this much requirement. Then after supplementary with the vitamin D also. So vitamin D is also important for the bones. So make sure you are giving them. So that is about the 400 to 800 international unit per day. Then after the exercise and the walking and the jogging and the weight bearing exercise. Here, why? Because the woman who are having this menopause, there are more chances to get the cardiovascular disease, right? So why it happens? Because the HDL value is there, that is going to be increasing, okay. So if the cholesterol level is increasing inside the body, there is the most chances to get the hypertension, diabetes also will be there, or we can say the heart attack also can be there. So if the woman is going for the walking, or she is doing jogging and if she is doing the weight bearing exercise, so that this all can help to reduce her weight also and maintain her health also. Then after the cessation of the smoking and alcohol, if the woman is taking any alcohol, or if she is doing the smoking, so make sure she is quitting that. If she is not, so that can worsen her condition also. Then after the hormone replacement therapy, so what it is, as I have said earlier also, in menopause what happens, mostly all changes will be coming due to the hormonal changes, okay. So if the hormones, because why, the levels will be decreasing inside the body. If the levels are there, so all the things can function well. So here what we are going to do, here we are going to the hormones are there, that we are going to be replaced. So here hormone replacement with the estrogen or the progesterone is tried in the menopausal to replace the ovarian function or ovarian hormone to relieve the menopausal symptoms. So here what happens, here they are going to inject the estrogen, otherwise the progesterone, that both the hormones, not the both the hormones, one of them they will be introducing inside the woman's body. Why? Because they want to relieve the symptoms of the menopausal, because as we have seen earlier also, that menopausal symptoms can disturb the mentally also, and sleeplessness, everything will be there, right? So to relieve that kind of symptoms, the women used to take the hormone replacement therapy. So what is the indication for the hormone replacement therapy? So relief, for which woman you can use it. So relief of the menopausal symptoms like the hot flush or the vaginal atrophy. So the woman who have the more hot flushes, if she is not able to bear that, all the sweating and everything is not able to bear it, for them you can give it. Or even though the vaginal atrophy, why? Because here the vaginal area is there or vaginal canal is there, that will be decrease in the size. Okay, so for those women, if she wants to have a sexual life in the later on, so that time some women used to take the hormone replacement therapy also. Then after the prevention of the osteoporosis, why? Because the osteoporosis mostly happen due to the deficiency of the estrogen hormone. So if you are replacing that one, so that is a less chances to have the osteoporosis. Then after the progesterone estrogen therapy, so here what kind of therapy they are using for the this hormone replacement. So let's talk about that. So here we are going to talk about the progesterone and the estrogen therapy. Both the hormone they will be using combined together. So the combined continuous administration of estrogen plus progestin is most common mode of the administration. So here you can see some amount of the estrogen and some amount of the progestin. They will be injecting into the woman, and that is the most commonly they are using this one. So this regimen promotes the endometrial atrophy and result in the amenorrhea in about the 70 to 90% cases of the woman who use continued therapy for more than 1 year. It means that the mother, if they are taking this treatment for more than 1 year, they might can have the amenorrhea. So we can say there is a chances to get the bleeding about the 70 to 90% cases. So we can say the menstrual bleeding will be there for this kind of women who is taking this all the treatment. Okay. Then after, another option is that administer progesterone such as the metyroprogesterone acetate at a dose of the 5 to 10 mg per day. So here they will be using the only progestin drug, okay, or progestin hormone. So that is the medroxyprogesterone acetate. So this kind of drug they will be using, okay, and the dose will be about the 5 to 10 mg per day for at least 12 to 14 days of the each month. For each month she has to take this tablet for 12 to 14 days. So in this, 80 to 90% of the women will experience some vaginal bleeding towards the end of the month. If she is taking for a few months, she might have the vaginal bleeding also. Then other alternative is to prescribe a lower dose of the 2.5 mg continuously. So here they have reduced the dosage of the drug. So here before they used to before, as we have seen, that is about the 5 to 10, but here they are giving the only 2.5. Then after the contraindication, so for which woman you can't use this one? So undiagnosed abnormal vaginal bleeding. So you have to know before prescribing this all the drugs. Hormone replacement therapy you just can't give to every woman. You have to see their criteria also, okay. So make sure if a woman is having the continuous vaginal bleeding, for them you can't give this therapy. Why? Because by giving this therapy, what happens, she might have the more blood loss also, okay. So due to that, make sure you don't give for the woman who have the undiagnosed abnormal vaginal bleeding. Then non-suspected or the history of the cancer of the breast. If the woman have the breast cancer history, so for them also you can't give this one, because that can we can say the proliferation of cell that can be increased. So make sure you don't give for them also. Then known or the suspect estrogen dependent neoplasma. It means that the woman who have the neoplasm or the cancer which is going to affect on the estrogen. It means that if you give the estrogen therapy and then due to that what happens, some cells are there that will have the growth because of this hormone. So after giving this hormone, what happens, her condition can be worsened more. Then after active deep vein thrombosis, even though if she have the active deep vein thrombosis also, then after the pulmonary embolism or the history of this condition, so that is also for this kind of woman you should not give. Then after the arterial thrombophlebitis or the stroke, or we can say MI or the stroke if she had, so for that also you won't be able to give. Then after the liver dysfunction or any disease are there, So for those all the women, you won't be able to prescribe the hormone replacement therapy, because that hormone can we can say the affect to this all the things, and that can worsen the condition of the mother. Then after the complication of the HR, what is a complication will be there of the hormone replacement therapy. So here what happens, endometrial cancer. So there is a might be chance to get the cancer also of the endometrial. So high dose and the prolonged treatment can be increase the risk of the cancer. So if the woman is taking the high dose, okay, for the 2 to 3 months, years, or the 4 years or the 5 years if she is taking, so that can interfere with the we can say the cell, okay, and it can have a if there is a abnormal proliferation are there, so that can have the cancerous or the neoplasm also will be there. Then after the breast cancer, so risk of the breast cancer present, so BSE, so that is a breast self examination. Careful breast assessment and routine screening mammography should be done. If there is a chances or there is a history of the breast cancer, so for them make sure if there is a chances also we are not able to give this therapy, okay, for those women also make sure you go for the mammography, okay, so by that also they can check any lumps are there or not inside the breast. Even though as you can see breast self examination, here they have talked how the woman can do the examination of her breast by herself. So as you can see, so this can be done by when the mother is in the while she is taking the bath, okay. So what happens, as you can see, one hand has to be lifted over it and one hand has to be keep over the breast, and on the circular motion she has to do the circular motion. And if you're while you do the palpation, if you feel any kind of lump, okay, so you can understand, okay, if small lumps are there, so might be there is a chances to get the breast cancer. So that both the on the both the side you have to check it, and sometimes you have to squeeze from the nipple also and see whether is there any discharge or not. Then after the thromboembolic disease, so risk for the venous thromboembolic disease, so for them also this kind of complication will be there. Then after the cardiovascular disease, so estrogen decreases the LDL and the total cholesterol while raising the HDL. So here we can say the bad cholesterol and the good cholesterol for the body, right? So here what happens, the good cholesterol are there, that will be decreased, and which is the bad for the body, that level will be rising. So what happens, there is the most chances to get the cardiac arrest or the cardiovascular disease will be there. And the triglyceride, so it is also decrease in the lipoprotein and the fibrinogen. So we can see the lipoprotein and the fibrinogens are there, that is also going to be decrease in the amount. So we can see the woman who is taking the this hormone replacement therapy for a prolonged time, so for those women this kind of complication will be there. Then after the stock, if the woman have the stock or any or we can say after taking this treatment, might be she can develop this condition. So hormone replacement therapy associated with the increased risk of the stroke also. So if she is taking for a 5 years or 10 years, so for that, for those women it will be there. Then after the uterine bleeding, so in women taking estrogen only, the incidence of the endometrial hyperplasia can be the higher as the 25% after only 1 year of the therapy. So here you can see when the woman is taking this drug, okay, for at least 1 year, that time about the 25% cases the mother will have the uterine bleeding. So as a pre-treatment biopsy and yearly endometrium biopsy are required for the woman who is receiving the estrogen to assess the presence of the hyperplasia. So here why? Because if the woman is taking more than the 5 years or 6 years, there is a chances to get the cancer also, okay, endometrial cancer. So what happens, every year she has to go for the biopsy, whether there is any cancerous cells are there or not. So for that she has to go for the this examination. Then after the gallbladder disease, estrogen can cause the high amount of the cholesterol to collect the bile. So gallbladder disease also can be there. Why? Because here the HDL is there, that is going to be raised. So we can say the bad cholesterol are there, that is going to be raised inside the body. So that can also have the effect, right? Then after the mature menopause. So what do you mean by the premature? Premature, it means before the age the menopause is coming, right? So menopause occur at or below the age of the 40. So treatment by the substitution therapy is usually followed. So most probably, if the woman is having the menopause, or she has menopause at the age or age of 40 or below the 40, that time she can use the therapies as you have seen earlier, right? Then after the delayed menopause, so menopause does not occur beyond the age of 55 year of age. So we can say most probably within the 55 year of age, the woman will be attaining her menopause. Most probably it won't happen. So detailed investigation for any pelvic pathology and appropriate treatment is indicated. So women who have the delayed menopause, for them the further investigation is really important, okay, like the pelvic pathology and everything. Then after the artificial menopause, what it is? So permanent cessation of the ovarian function as a result of surgical removal of the ovaries or by the radiation. So how you can have the artificial menopause? So by the removing the both the ovaries, okay, so by that you can have the and that ovary removal is known as a oophorectomy, okay. So by that the woman can have the artificial menopause. So till now whatever we have seen, that is everything is about the menopause, and this question they used to ask in the 5 marks short note. Make sure you understand this well. Thank you.